Many people complain of back pain. This is a mind map of branches of the lumbar plexus. We will gradually go through each branch one by one. This is a diagram of the lumbar plexus with its branches and its one anterior and one posterior divisions of the primary rami. First lumbar, second, third, fourth, and fifth. The 12th thoracic nerve, the subcostal, may take share in the plexus sometimes. The yellow branches are the anterior divisions and the green branches are the posterior divisions. Now L1 is going to bifurcate into iliohypogastric nerve and ilioinguinal nerve. Now L1 and L2 anterior divisions will unite and form the genitofemoral nerve. L2, L3 and L4 will form the obturator nerve. L4 and L5 will form the lumbosacral trunk that connects the lumbar plexus with the sacral plexus. Now L2, L3 and L4 posterior divisions will form the femoral nerve. L2, L3 will form the lateral cutaneous nerve of the thigh. This is a dissected body showing the lumbar plexus, and this is the 12th intercostal nerve, the subcostal nerve, which may take share in the formation of the lumbar plexus. This is L1 running on quadratus lumborum, reaching the iliac crest, and it bifurcates into iliohypogastric and ilioinguinal. This is the lateral cutaneous nerve of the thigh running on the iliacus muscle, and this is the largest branch, the femoral nerve, coming out from the lateral border of the psoas major muscle, and it runs in the groove between iliacus and psoas. This nerve is the genitofemoral nerve. It emerges from the anterior surface of the psoas major muscle, and then this is the obturator nerve emerging from the medial side of the psoas muscle, the only one that does that. This is a diagram of the lumbar plexus. The red marked roots and nerves are those of the obturator nerve. It comes from the ventral rami of L2, L3, L4, and then comes down at the pelvic brim, runs on the lateral surface of the true pelvic cavity, and then emerges from the obturator foramen and enters the adductor canal. This is the general plan of the obturator nerve. It arises from L2, L3 and L4, and as it goes into the upper part of the thigh, supplies pectineus, adductor longus, adductor brevis, gracilis, and obturator externus. This is a cadaveric view of the lateral wall of the pelvic cavity, the true pelvis, and here is the obturator nerve. It runs on the lateral wall of the pelvic cavity until it reaches the obturator foramen, where it gets into the adductor group of muscles. This is a diagram of the pelvic floor. When you look at the lateral wall, you can see that the obturator foramen is covered with a muscle called obturator internus with its own internal fascia, and there is a hole in this fascia which is called the obturator canal. This is a view of the lateral wall of the true pelvic cavity, where you can see the obturator nerve running on the lateral wall of the pelvis, reaching the obturator. This dissected cadaver, you can see that this is the psoas muscle, and this is the iliacus, and the obturator nerve comes out from the medial side of the psoas, running on the lateral wall of the true pelvis, reaching the obturator foramen. When the obturator nerve comes out from the obturator foramen, enters the adductor group of muscles, the medial group of the thigh, and it reaches the adductor brevis and divides into anterior and posterior divisions. This is the upper part of the thigh, the medial side, where you can see that this is the anterior division of the obturator nerve. You go lower down, you see it's branching to the supply of different adductor muscles. Now, just medial to the anterior division, you can find the posterior division of the obturator nerve. This slide is showing a dissected medial side of the thigh, and without cutting any muscle or reflecting any, you can see the anterior division of obturator nerve. This is a plan of innervation of the anterior part of the thigh. Now, the yellow marked area is the area supplied by the cutaneous branches of the obturator nerve. The cutaneous area supplied by the obturator nerve may overlap with other nerves, and sometimes it is lower down on the medial side of the thigh. This is the general plan of the obturator nerve. It arises from L2, L3, L4. Now, what is the story of the roots? They emerge from the medial wall of the psoas major muscle. This is the only nerve that emerges from the medial wall of the muscle, and the nerve enters the true pelvic cavity, runs in the wall of that cavity, and it reaches the obturator foramen or obturator canal. comes out of the pelvis and enters the adductor medial group of muscles and divides into anterior division and posterior division at the upper border of adductor brevis. The anterior division will send an articular nerve to the hip joint, and it supplies the pectineus muscle. The pectineus muscle gets double nerve supply from the femoral and from the obturator nerve. It gives a branch to adductor longus, gracilis, and it gives the cutaneous branch to supply the skin on the medial aspect of the thigh. Now, the posterior division is going to give a nerve supply to the obturator externus, the adductor magnus, which also receives double nerve supply from the obturator, but mainly from the obturator nerve, partly by sciatic nerve, and then the nerve enters the adductor hiatus and gives articular twig to the knee joint, where it ends there. This is an animated slide of the obturator nerve. Please press the down button so that you can see the different sentences. Now let's look at the genitofemoral nerve. The genitofemoral nerve comes from anterior divisions of two roots, the L1 and L2. In this dissected body, the yellow marked structure is the genitofemoral nerve, which comes out from the anterior surface of the psoas major, the only one that does that. As the genitofemoral nerve comes from the anterior surface of the psoas major, it runs on it, and then it divides into two branches. The medial one is the genital branch of the genitofemoral nerve, and the lateral one is the femoral branch of the genitofemoral nerve. In this image, when the external oblique aponeurosis is reflected up, we can see the genitofemoral nerve coming down through the inguinal canal. The genitofemoral nerve, as it runs for a short distance in the inguinal canal, the femoral branch will continue underneath the inguinal ligament to supply the area of skin underneath the inguinal ligament, and the genital branch will continue with the spermatic cord to supply skin of the scrotum. Now let's look at the basic knowledge of iliohypogastric nerve. The first lumbar anterior division will sometimes receive few fibers from the subcostal nerve, and as it comes laterally from the lateral border of the psoas major, it divides into two branches, the iliohypogastric and ilioinguinal. In this dissected body, the yellow line represents in its upper part the first lumbar branch, and it runs on quadratus lumborum, which is going to bifurcate into two branches. The yellow marked is the ilioinguinal, but the superior one is the iliohypogastric. As they turn towards the lateral part of the abdominal wall and then anterior between the muscles of the lateral wall of the abdomen, this is the iliohypogastric nerve going towards the midline. This image is showing that the iliohypogastric, as it goes through the layers of the anterior abdominal wall, it bifurcates into two branches. Both of them are cutaneous, and this area around the inguinal ligament a little bit superior, and then the other branch will supply the upper lateral part of the thigh. Now let's look into the basic information about the ilioinguinal nerve. L1 will form a single nerve that comes out from the lateral border of the psoas major. Sometimes it takes origin also or few fibers from subcostal nerve. It bifurcates. The inferior one is the ilioinguinal nerve. As it goes from the lateral abdominal wall into the anterior one, it is going to supply area above the inguinal ligament. L1, as it comes from the lateral border of the psoas major, runs on quadratus lumborum muscle and then divides into two branches. The continuation of the yellow marked structure is the ilioinguinal nerve, reaching the iliac crest. This is the external oblique muscle aponeurosis reflected to show the lower part of the anterior abdominal wall, where you can see this is the iliohypogastric nerve, a branch of L1, and then ilioinguinal nerve, which is going to get into the inguinal canal in the spermatic cord, and as well as the genitofemoral nerve. This is a dissected body where you can see the white shining oblique structure is the inguinal ligament, and inside this oval structure is the ilioinguinal nerve inside the ilioinguinal canal. Then the ilioinguinal nerve will come out of the inguinal canal at the external inguinal ring. Now on the right side, the pink area shows the iliohypogastric nerve skin innervation. Then the one below it is the area of overlap between the two nerves, the iliohypogastric, ilioinguinal skin innervation. This is a wound of open appendectomy, and you need to decide if this patient is in pain. You block which nerve, the iliohypogastric or the ilioinguinal. This is a repair wound of a direct inguinal hernia, and it lies in the territory of which of the following nerves: iliohypogastric or ilioinguinal. This is a mind map of branches of the lumbar plexus. Now let's have a look at the basics of lateral cutaneous nerve of the thigh. This is the plan of lumbar plexus, where L2 will give a branch, L3 will give another one, and these two will unite to form lateral cutaneous nerve of the thigh, also called lateral femoral cutaneous nerve. As the lateral cutaneous nerve of the thigh comes out from the lateral border of the os major, it runs over quadratus lumborum, crosses the iliac crest, and then lies on the iliacus muscle. Three nerves are related to the inguinal area. Number one is anterior cutaneous branch of the iliohypogastric nerve within the inguinal canal. The inguinal nerve itself also within the inguinal canal, and the genital branch of the genitofemoral nerve is within the spermatic cord.